Hello, I'm Meenakshi Swaminathan, and today we are going to look at how to assess communication skills. The goals and objectives of this talk are to introduce assessment methods in communication skills training, to discuss the pros and cons of each method, to familiarize the participants with steps of assessment planning. By the end of this lecture, the participant will be familiar with various assessment methods, be able to choose the appropriate assessment method, and know who will do the assessment and what will be done with the results. The flow of the talk will be as follows: assessment of communication skills, where will it be done, which methods are available, who will do the assessment, what will you do with the assessment, and do assessors themselves need training? Here's a question to you, the participant. How do you assess your student in communication skills in your program currently? The assessment settings where the assessment takes place could be either artificial examination-like. It's good because you can provide appropriate, timely feedback, and often they serve as stimulus for improvement. It could also be at the workplace, thereby you can give feedback in different scenarios, and generally tends to be a familiar, non-threatening environment as opposed to an examination-like setting. It is important that the assessment conforms to the Miller's pyramid. That is, knows how is tested with written tests, tells how by reflective journaling, shows how perhaps with an OSCE, and does with a Mini-CEX. Now you all would agree that written tests are not ideal. Communication skills are better assessed in the real-world context or with simulated patients. But the written tests may be helpful for evaluation of understanding of concepts. And in certain settings, due to financial and manpower constraints, to implement other methods, written tests may be all that you have. The OSCE, Observed Structured Clinical Examination, conforms to level 3 of Miller's pyramid. It can be both formative and summative. When designing OSCE stations, it is better to test several competencies. The assessment is best done contextually rather than in isolation. Communication skills can be assessed in history taking, ophthalmic examination, and counseling stations. Using global rating scales are better than checklists. Here you can witness the assessment by a communication skills trainer in an OSCE station. A Mini-CEX or a mini clinical evaluation exercise is another popular method used to assess communication skills. You can use observation in real-life situations, could also use it in inpatient, outpatient, and emergency situations. A Mini-CEX assesses performance and action rather than competence. The standard forms have a communication skill assessment in medical interviewing skills, humanistic qualities, professionalism, and counseling. And multiple observations by multiple faculty adds value. The faculty need training in assessment. First, it's important that the tools used for assessment are validated, and then training of faculty happens, and then appropriate tools are selected. The rating tools can be used for self-reporting or rating by a faculty or external rater, followed by feedback. It could also be rating by patients. It's important to use multiple sessions, multiple assessors, and multiple contexts. It's also good to move away from objectivity and introduce subjective assessment. Planning communication skills training and assessment. It is important to take into consideration the opinion and participation of all three stakeholders, that is, the student, faculty, and the patient. So, who can do the training and assessment in communication skills? Well, these could be medical school faculty, postgraduate faculty from multiple disciplines, specialists in communication like psychologists, maybe general practitioners who have interest in medical communication. They could be nurses, paramedical staff, or trained personnel. Time for reflection. Have you used any of these methods? What were the challenges you faced? Who does the communication skills assessment in your program? What change would you like to see in the way you do assessment of communication skills? So, what training do assessors need? Maybe a workshop. They would need training in assessment tools, training in observation, and also training in giving feedback. So let's look at an example of types of assessment for medical students. In the early years, these could be in the form of reflections, grading and feedback. In the middle years, these could be OSCE, feedback from trained simulated patients, Mini-CEX, and reflections. And later on, it could be again OSCE, feedback from simulated patients, Mini-CEX, DOPS, and reflections. In conclusion, assessment of communication skills is essential in both formative and summative assessments. It is important to involve the stakeholders in the process. Feedback and continuous improvement are the cornerstones of this important skill. Thank you.